This is a repeat of the presentation titled ODE Changes in ASD Evaluation and Eligibility, presented on December 14th by Linn, Benton, Lincoln Education Service District. It was co-facilitated by Cindy Madden, Cascade Regional Program Administrator, as well as staff from Special Education Evaluation Services Program, including Kate Maroney, Administrator, Debbie King, Speech and Language Pathologist, Jennifer Barabee-Snyder, Autism Evaluator and Learning Consultant, and Alan Mom, Autism Evaluator and School Psychologist. In overview, we will discuss the Regional Program and Technical Assistance Paper, or TAP, 7 knowledge areas, changes to the eligibility requirements, differentiation among eligibilities, re-eligibility, new eligibility form, and the new report. Cascade Regional Program provide services for children with low-incidence disabilities and are provided through 8 regional program contractors throughout the state. Each program hires trained, certified staff to provide the needed specialized services. Statewide coordination is provided by a Regional Management Team, or RMT. The RMT designed professional learning teams for each area of low-incidence disability to work specifically on professional development or big changes that affect the eligibility area. Linn, Benton, Lincoln professionals that are on that team are Amanda Stenberg and Melissa Bermel. For the past few years, the PLT has been working on revising the ASD Technical Assistance Paper. The TAP was written in 2009 and updated in 2010. Currently, the PLT is working on completing the 2019 update in order to implement the revision of OAR 581-015-2130, which was officially approved on January 2018. The TAP is meant to guide all early childhood and school-based professionals evaluating and/or serving students with ASD, including autism specialists, speech and language pathologists, school psychologists, special education teachers, and other related service providers. LBL ESD has autism consultants that work for Cascade Regional Program, but they are not the evaluators in our area. Each area around the state can look different, and LBL is unique in that we have evaluator teams to support those 12 districts, as Kate will delve into a bit later. For more information about the TAP, please see the Oregon Department of Education website for low incidence regional supports.
Now I'm going to review some of the changes from ODE. I'm going to go over them briefly, and then some of them we're going to delve into deeper later in the presentation with some other evaluators. As you can see on this slide, the DSM-5 language has now been integrated into the OAR related to autism evaluation. The TAP, which Cindy referred to earlier, the Technical Assistance Paper, refers to an individual that needs to have knowledge of the DSM-5 characteristics to be on the evaluation team so as to identify autism and other differential disorders, to be able to distinguish between them in 3 of the 7 knowledge areas. We're going to talk about the knowledge areas in just a bit. Although there is a distinction made by ODE and in the TAP that the eligibility criteria are separate and distinct from the medical diagnostic criteria, much of the language is consistent between the sets of criteria, but they're just grouped differently. So this picture of the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, is the manual that most medical and mental health practitioners use and reference prior to making diagnoses. So as you can see, the ODE OAR regarding autism has changed some of the wording, but by and large, this is just a sample of how the intent of the language is consistent between the new OAR for autism and the DSM-5. So Alan is going to go into this characteristics before age of 3 later in the presentation, but this is just an example of how they're pretty much the same with just a slight deviation. Regardless of the similarities in the language, we must make it quite clear to parents that we do not diagnose autism in the schools. This has not changed. We do not diagnose anything listed in the DSM-5. Our sole purpose continues to be to evaluate and determine educational eligibility for special education services. Another note is that Asperger's no longer exists in the DSM-5. So if you currently have students on IEPs with an Asperger diagnosis, you can continue to serve them under autism. The distinction between a medical diagnosis and an educational eligibility has not changed. ODE acknowledges that there is significant overlap between the DSM-5 and the new Oregon educational criteria. ODE charges school teams to spend time helping the parents understand this difference. Even with the switch to the DSM-5 language, the fact remains that a diagnosis still does not result in an automatic eligibility of autism. That is why we must stress that the educational model relies on these two eligibility questions. Without yeses for both, a child will not qualify. Again, this has not changed, but we must stress this to distinguish between the fact that we are now using language that's quite similar with the medical diagnosis, but we still have our own educational criteria that must be met. So the technical assistance paper that Cindy referred to earlier has given us additional guidance related to evaluation requirements. This slide indicates the changes in the OAR related to what is required as part of an autism evaluation. ODE has made the required evaluation components more specific than in the previous OAR. These are the changes that will be reviewed more in depth by other presenters. A couple of things important to note about the changes are related to our region in particular and how we conduct our evaluations. For instance, when a student comes in the center for an initial autism evaluation, we have always taken a thorough health and developmental history, and we've always conducted a thorough parent interview. The TAP clearly states that this is an expectation, as it has been an expectation previously. What has changed is that currently we need to see autistic characteristics historically presented as well as currently presented. A change in the OAR now states that characteristics can be noted historically or currently. Again, in the center, we have always used standardized autism tools like the ADOS and the SRS. This is not a change for us, but for others it will be, as ODE has explicitly stated through the TAP that a standardized autism tool is required. Although a medical statement is not required for school-age students any longer, the differential initial evaluations conducted by the EdEval Center will consistently ask for the district to provide information to rule out the presence of another health issue and/or physical factors that may impact the child's educational performance for a child ages 5 to 21. The new OAR indicates that a medical statement is only required for students 0 to 5. Made this optional, it is also clear that the school team may determine obtaining a medical statement or a medical assessment as necessary if there is a differential question at hand. For the purposes of the Education Evaluation Center, again, if the referral question involves a differential between autism and another mental health or medical condition, we may ask for a medical statement to be gathered. Again, when students come in the center, we have always asked for hearing and vision information prior to conducting an initial autism evaluation. And if one is not available for hearing, we have obtained a hearing screen ourselves. We stress that we cannot validly evaluate for autism if we have not ruled out a hearing loss or a lack of vision as the main concern at hand. Cindy will address vision and hearing screening later in our presentation. Additional guidance and expectations have been given from ODE related to the team competencies of those conducting the autism evaluations, and specifically in the 7 knowledge areas listed on this slide. ODE has stated that the team, at a minimum, must include one of each of these types of licensed individuals: someone knowledgeable about the behavioral characteristics of autism, and an SLP. Of course, the parent and/or caregiver must also participate. Licensed individuals that fit the specific roles listed in the competencies could be special education teachers, occupational therapists, school psychologists, and autism consultants or specialists. Each district and ESD is responsible to verify that the evaluation team is appropriately trained and experienced. ODE has identified a set of 7 knowledge areas to address core skills that are needed to meet the criteria as a person identified as knowledgeable about behavioral characteristics in autism. Knowledge Area 1. Someone who is familiar with typical child development, such as developmental milestones and theories of development, such as Piaget. Knowledge Area 2, someone who is knowledgeable about atypical child development, someone who has the ability to identify different developmental pathways resulting in different disorders. Knowledge Area 3, mental health disorders. This individual is able to differentiate autism with other DSM-5 disorders like intellectual disability or anxiety or obsessive compulsive disorder. Knowledge Area 4, someone who is familiar with formal and informal assessments. So this individual has the ability for evaluation planning, can collaborate with team members, and knows the differences between these types of tools. Knowledge Area 5, tools for autism identification. This individual can determine whether tools are reliable, valid, and accurate, and they are aware of the psychometric properties for the assessments. This individual would be competent in selecting, administering, scoring, and interpreting the assessments. Knowledge Area 6, autism characteristics. This individual would be able to describe or identify the current DSM-5 criteria for autism, the diversity of the autism population, changes in characteristics over developmental stages of autism, and differences dependent on gender, culture, language, socioeconomic, as well as the severity scores under DSM-5 or comparison scores on the ADOS. This individual also would be able to describe the theory of development and the psychological and neurological processes of autism. And Knowledge Area 7, family and environmental dynamics. This individual will be able to describe the effect of culture on social interactions and the potential impact of family interactions regarding maternal depression, disabilities in parents, drug and alcohol use, and other home dynamics on the identification of those with autism. ODE also states in the TAP that it's best practice to have an autism specialist or consultant participate on the evaluation team whenever possible. Now I'm going to cover how our region and our evaluation teams and that Eval Center will address the knowledge areas listed in the TAP and the expectations of ODE related to the evaluation team. Again, the slide in front of you is reflecting how our at Eval Center teams would address the competencies needed for our region. If you were to go elsewhere in the state, the team might not look the same. This chart illustrates how all knowledge areas are covered by our 4 core team members. There may be times when the team leader of an in-center is also the autism evaluator, or also the speech-language pathologist, or also the psychologist. There will only be 3 team members for those types of teams. If the school team is not requesting a differential evaluation, the autism team will only be looking at autism and therefore may only consist of the autism evaluator and the SLP. This is sufficient because knowledge area 3 and 5 are related to mental health and DSM-5 disorders and would not be applicable if there isn't a differential concern. Again, for our very specific circumstances in our region, this is how the competencies and the knowledge areas would be addressed for all initial autism evaluations. Now Cindy is going to review the new requirements related to vision and hearing screening.
Another change with the new ASD eligibility criteria are the requirements for vision and hearing screening. Really, this requirement is more about finding existing information in the child's cumulative or special education file. Typically, children are screened in elementary school for both vision and hearing, so it's a matter of locating that documentation. And to date, ODE does not require that these screenings have to be done within a certain time frame. For example, I asked Linda Brown, who is providing training across the state, this example. What if I have an 8th grade student that is being considered for an initial eligibility of ASD, and we can only locate a hearing screening from kindergarten? She said that would be enough information. Of course, we need to use our best judgment. If the student has undergone some head injury or some other trauma that could impact their vision or hearing, it is our responsibility to gather new information. The idea being we do not want to find a student eligible for an autism when in fact it is a sensory related deficit that is causing some of the social interaction or repetitive behaviors. ODE is still working on guidance around this topic because there have been many questions, but for now we have created a flowchart for staff to follow when considering these new components. Here you can see the process for locating existing documents. As you progress through the flowchart, there is a hearing screening checklist that ODE has created, and I'll share that with you in just a minute after I share the vision screening process flowchart. Basically, you're just checking files, and if you aren't able to locate a screening, you reach out to your district or school SLP and they can conduct a screening. The screening checklist is really more about if the student is really difficult to test and there don't seem to be any major concerns, and I'll show you that again as I said. Here's the vision screening process. Very similar. It's just trying to find those vision screening results. And again, after looking through all of that and not finding it, then a good person to contact within your district or your school is the school nurse, who can attempt the vision screening. So, and then after that, if you're still struggling, again, there's that vision screening checklist interview. So I'll show you that next. So if we go to ODE's website, on the autism spectrum disorder page, and if you scroll down, they have information about, first of all, the different regions around the state, and then they have information about the new ASD criteria and evaluation components. The hearing screening checklist interview is here. And as you can see, it's just a yes, no, and I think there's 15 questions. And if you find that you can answer no to all of these questions, then ODE will accept this as the hearing screening on the eligibility form. Along those same lines, here's the vision screening checklist interview. Again, this is an interview that should be completed with the parents and only proceed using these documents as the vision or hearing screening if the team is able to answer no to all of these questions, and they're 18 for the vision screening. Just as a side note, the tap will also be located when it is complete. They had it up for, here it is, oh, sorry about that. Here it is, the current one, or the 2010 one, and they will be updating this as that tap is completed. Just an interesting article that I came across was this given by ASHA, and it's 10 tips for testing hearing in children with autism, and it would follow again for vision as well. It's more about behavior supports to increase cooperation. One note I wanted to share is that the Cascade Regional teachers for the deaf, hard of hearing and teachers for the vision impaired are not staff that can be used to conduct the screenings. Those staff are purely to support students that have existing vision impairments according to the OAR guidelines, and or those hearing impairments according to the OAR guidelines, so they're already eligible for those areas.
This is Debbie King, and I'm going to talk to you today about the new ASD eligibility requirements. Specifically, I'm going to talk to you about the social communication area. In previous criteria, the student had to exhibit impairments in 4 areas, which included communication, social interaction, patterns of behaviors, and unusual responses. The new criteria is saying that they have to exhibit all 3 deficits in the area of social communication. Those 3 deficits include social emotional reciprocity, nonverbal communication behaviors used for social interactions, and developing and maintaining and understanding relationships. So the key change here is that the social and communication are now a combined category. And when you look at the eligibility paperwork, you will see that there are some descriptive examples, but I'm going to go through and talk about some of those right now. So the next area that is going to talk about is social emotional reciprocity, is when it's a back and forth interaction that takes place in communication. It's the ability to form mutual connections and work with those around you. So some examples of that could be showing an interest in others, imitating others, responding to name, enters and exits a conversation appropriately. Those are all parts of what social emotional reciprocity can look like. The next one is nonverbal communication behaviors, and that is the ability for a student to be able to know the thoughts and read facial expressions, read body language, which is super important for them to know when and to interrupt a conversation, or how to do that appropriately, how to know if somebody is bored with what they're saying. It's making appropriate eye contact. It's using gestures and understanding what they mean. It also has to do with voice loudness and prosody and rate. Those are all parts of what nonverbal communicative behaviors include. The third area is that they have to be able to show that they are developing and maintaining and understanding relationships. So this is called a lot of times theory of mind, and it's the intuitive ability to infer what other people are feeling or thinking. So again, it's knowing the awareness of the unwritten rules of conversation. It's the ability to code shift, talking to an adult versus talking to a peer, you might use different kinds of words and intonations of your voice. It's inferring and knowing what to say about the emotional state of others, and it's that give and take that helps to make communication. So there are 5 key concepts regarding social communication. The role of this is not to be able to say that they have ASD, but the point of it is to be able to say that there is a social communication present, and that there is difficulty, there's deficits in that. Once you start looking at the social communication, there's lots of different eligibilities besides ASD that a student could be exhibiting. We see lots of kids that have ADHD. We see lots of kids that have intellectual deficits that also have social communication deficits. So our goal for the SLP is to make sure that we are seeing that there is a social communication deficit. And we're looking to see that it's in different environments, not just in socialized, standardized testing. A lot of times we just think that if we do the standardized testing and it shows that they're scoring within average range, then they don't have a social communication disability. But that's not true. The purpose of our testing is not to give a standardized score. The purpose of our testing is to make sure that they are exhibiting social communications in different kinds of environments, and that they are showing it with different groups of people. So we know what typical development for social communication is because that's what we've learned when we're in SLP, but it may not, that allows us to know what the not typical looks like for social communication. And so we're going to be looking at that. We're going to be seeing how that child, how that student uses that communication in multiple contexts. That's the big deciding factor, is that it needs to be in multiple contexts with multiple peers or adults that they are close with. And again, it's not the final determination of eligibility. All of the evaluation data will need to be considered. So, in summary, the functional communication is to look at we need to know what their receptive and expressive is so that we can be able to say if that's typical or not typical. We need to be able to look at their pragmatic skills across natural contexts, and we have to make sure that we understand and know what their social understanding is in different environments and different contexts with different peoples. And that includes their social emotional reciprocity.
Hi, this is Jen, and I am starting with the area where we're talking about restrictive, repetitive patterns of behavior, interest, or activities that must have at least 2 of the 4 currently or by history on your eligibility form. So when we're talking about restrictive, repetitive patterns of behavior, interest, or activities, we're looking at stereotyped or repetitive motor movements, use of objects or speech, insistence on sameness, inflexible adherence to routines or ritualized patterns of verbal or nonverbal behavior, highly restricted, fixated interests that are abnormal in intensity or focus, and hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of the environment. Now remember, you only need to find 2 of the 4. That doesn't mean if you find more than that, you can't mark yes to those, but you are looking for only 2 of the 4 that demonstrate persistent deficits across multiple contexts. So when you're talking about number 1, stereotyped or repetitive movement, use of objects or speech, you're looking at behaviors in this category that are extremely variable across individuals with ASD. Stereotypic behaviors can be verbal or nonverbal. They can involve gross or fine motor and can be simple or complete. They can also occur with or without objects. Stereotypies are produced by developmentally typical infants and toddlers. These behaviors often resemble the stereotypies observed among individuals with ASD across the lifespan. I'm going to say that again, lifespan. However, stereotypies produced by individuals with ASD tend to appear more unusual or bizarre in comparison. So an example of some motor stereotypies would be hand flapping, finger flicking, rocking from foot to foot, twirling hair, intense body tensing. Repetitive use of objects could be such things as lining up toys or objects, spinning items, or turning lights on and off repetitively. Repetitive speech is echolalia or pronoun confusion. Those are just examples. They're not exhaustive. On to insistence on sameness, inflexible adherence to routines, or ritualized patterns of behavior. Okay, number 2. For insistence on sameness, inflexible adherence to routines, or ritualized patterns of verbal or nonverbal behavior, you're looking for the rigidity to following a specific routine, following unusual child-specific routines, always laying out letters in the same order or shape. Or another example would be the compulsion to finish what was started, difficulty with stopping an activity. Highly restrictive, fixated interests that are abnormal in intensity or focus could be interests that are preferred, that are objects and activities other than people, excessive focus on irrelevant or non-functional parts of an object. Range of interests can be very narrow. So those are some examples. And when we're talking about hyper or hyporeactivity to sensory input or unusual interests in sensory aspects of the environment, we're looking at covering ears to block out noise, maybe using headphones in areas with a lot of people, closing, covering, or squinting eyes to block out light or other input that is visually overstimulating, comments on smell that others don't detect, maybe wearing certain clothing to avoid tags or certain fabrics. Hyposensitivity would be high tolerance for pain, rocks back and forth, maybe excessive and rigorous swinging, or seeks out proprioceptive type input. I'm going to talk about number 11 on the eligibility form, where we are looking for the evidence that the child demonstrates the pattern or characteristics. First, we're going to look for it to be persistent and across multiple contexts. So in the social communication, we need all 3 areas to have a persistent deficit across multiple contexts, and it needs to be documented currently or by history. And again, in the restrictive repetitive patterns of behavior, interests, and activities, we're looking for 2 of the 4 that is currently or by history and persistent. So when we're looking at persistent, we're looking that the team has documented these characteristics and they continue to occur or endure over a prolonged period of time. Multiple indicates 2 or more. Context encompasses different settings within the same or different environments. Example would be the classroom or cafeteria and playground. They all are in the school setting, but we are noticing the characteristics of autism across different contexts, so in different areas of their school day. Currently or by history, social communication and social interactions and the restrictive repetitive patterns of behavior, interests, or activities all need to have areas where they are seen currently or by history. Social communication deficits in autism spectrum disorder are pervasive and sustained. So you usually will find your social communication and social interaction across settings, and you will be able to see them as pervasive and sustained, typically with students with ASD. It is possible to meet criteria in one or more of the 7 domains, particularly the restrictive repetitive patterns of behavior, interests, and activities, by documenting that deficit in the domain that are clearly present during a childhood or in some time in the past, but not currently. So you might not see an insistence on sameness, But if it's documented historically, that is an area where you can go ahead and mark yes. If it's in an evaluation in the past, if it is in past eligibilities, and it has been documented over time. Teams are encouraged to draw specific attention to a child or student's current profile. If you're looking at a historic presentation of the student's characteristics for autism spectrum disorder, you would look at two different areas. There is currently an adverse impact upon either developmental progress for the child's in ages 3 to 5, or upon educational performance for students age 5 and above, or the child or student needs specially designed instruction in special education.
Hi, my name is Alan, and I will be talking about different changes in the autism eligibility. One of the changes is the following. The child demonstrates characteristics of autism spectrum disorder. Characteristics of autism spectrum disorder are generally evident before age 3, but may not have become fully evident until social demands exceed limited capacities or may be masked by learning strategies. So when looking at an eligibility for autism spectrum disorder, characteristics are generally evident before age 3 means that a lot of times those characteristics are seen early on before they enter school or early on in their childhood. Some possible sources of information that the school team can gather for this include, but are not limited to, previous assessment reports, a developmental history, cumulative or special education file review, behavioral referral, or previous IEPs. Generally evident before age 3, this refers to the fact that sometimes characteristics related to autism can be difficult to detect during early childhood. Oftentimes, the gap in development between a child and their peers is not that wide, and so sometimes characteristics are often characterized just as odd, or maybe that that student is just a little bit out of the ordinary. So for example, children often like trains. A preoccupation or intense focus with trains may not become fully evident that it's a characteristic until later on, as that perseveration continues and children move on to liking other objects or toys. Social demands exceed limited capacities. As children progress through development in school, the gap often becomes wider. For example, children are expected to learn how to sit in their seat, they make relationships, they learn how to be friends, and so for a child with autism spectrum disorder, they often engage in parallel play, which can be difficult to detect sometimes until they're in school, and they actually are asked to participate in teams, or they build relationships and they play in recess. And so even though a child who's younger may play around his peers, it becomes more evident as they go into school, where other peers start making friends and building relationships, and that peer is still engaging in parallel play. May be masked by learned strategies. So this concept generally applies to older students with autism who have developed appropriate coping strategies, skills, or the ability to self-manage behavior. One example of this could be a high school student who has learned to start, maintain, and end a reciprocal conversation through social skills, training, and practice. Just because he's learned this skill does not mean the student does not mean that the student does not continue to be eligible for autism. It's just that the social deficits are masked by learned strategies, so a team should not disqualify a student just because they've learned strategies to help cope with characteristics related to autism spectrum disorder. The next part of the eligibility talks about the characteristics of autism spectrum disorder are not better described or by another established or suspected eligibility for special education services. What this refers to is that there are often other eligibilities that are comorbid or exist with autism, or mimic different eligibilities, or different eligibilities mimic characteristics of autism spectrum disorder. Some of the most common eligibilities that either happen with autism or have characteristics similar to autism include intellectual disability, emotional disturbance, communication disorder, hearing impairment, vision impairment, traumatic brain injury, or other health impaired. It's important when we're differentiating between multiple eligibilities, and autism being one of them, that we gather multiple sources of information when attempting to differentiate between eligibilities. Important sources of information to consider could be developmental history, any medical diagnoses, or just previous and additional assessments that are gathered. New information may often lead a team to look at another eligibility or just simply direct their attention to look at a different eligibility. For example, maybe during a parent interview, a parent discloses that their child had a traumatic brain injury, which would then prompt the team to look at the eligibility for traumatic brain injury and most likely conclude that these characteristics could be related to a traumatic brain injury, not necessarily autism spectrum disorder. The next piece that the eligibility statement addresses is emotional disturbance and autism spectrum disorder. This is similar to the previous law under autism spectrum disorder in that autism has to be the primary eligibility if a student has both eligibilities of emotional disturbance and autism spectrum disorder. Here at LBL ESD, we provided guidance to our districts in differentiating or considering both autism and emotional disturbance as an eligibility. So if a team is looking at both of these, the team should first review the autism eligibility, but stop when they get to the question about the emotional disturbance eligibility. If a student is currently eligible as a student with emotional disturbance, the team has determined that autism is the primary disability. The team then reviews the emotional disturbance eligibility. If the evaluation data supported the qualification for autism, but only meets the emotional disturbance eligibility under the areas of interpersonal relationships and or inappropriate feelings and behaviors under normal circumstances, those characteristics can be subsumed under autism and should not be used as the sole qualifying characteristics for emotional disturbance. Those two areas, the interpersonal relationships and the inappropriate feelings, are often characteristics that are seen in autism. So if those are the only two boxes that are checked for emotional disturbance, those should not be the only characteristics that would then be used to qualify a student for emotional disturbance. However, if a student with autism spectrum disorder meets the emotional disturbance criteria for the other three categories, so the inability to learn, or the pervasive mood or depression, or the somatization, then the ED eligibility may be warranted, and the team should also look to see if emotional disturbance is another eligibility. If the student did not meet the qualification criteria under autism spectrum disorder, then any of the criteria under the emotional disturbance, which there are 5, can be considered and used for qualification. At the end of the emotional disturbance eligibility decision, the team should then go back to the autism form and answer the ED question and finalize the autism eligibility.
Okay, so this is Debbie again, and I'm going to talk to you about the educational impact and specially designed instruction that needs to go with ASD. So we've talked about what areas need to be included in the eligibility for an autism eligibility, but the important thing that we now have to focus on is the educational impact, because without an educational, that is the one thing that makes us different from the medical model. So the educational impact is the adverse impact on an educational performance in a broad scope. It's not just about the academic area. It also has to consider the non-academic areas like daily life activities, mobility, vocational skills, self-help skills. And in order for it to be impacting its education, it has to affect how that student has difficulty accessing their curriculum in the general setting. Again, it's not just about statewide and local assessments and if they're passing that or not. It also has to include those non-academic areas. We have to be able to determine the impact that may include part of an evaluation, both formal and informal, and we have to look at their strengths and their weaknesses and see how that fits into the educational model. All of this together with their history, with their classroom performance, with their social communication skills, with their social emotional reciprocity, all of that works together to see how that's impacting their educational performance. And when it does impact their educational performance, we have to be able to mark on the eligibility form yes or no. If it's not impacting them, then we click no and then we're done. We don't go any further. But if it is impacting them, then our next step is to determine what the specially designed instruction is going to be in order for that student to access their education. So let's go back a little bit more and talk about what educational impact looks like. So aside from the academic part and their scores and their grades, it could impact the way that they organize their life. If their notebook is a mess and they forget to turn in their homework every day, that's going to impact their education because they're not getting their work done. If they're very distractible or can't generalize what they've learned into other settings, that's going to impact their education. If they can't socialize and they're worried all the time about what they're going to be saying to an adult or what they're going to be saying to a peer, if they're wondering how they're going to be able to interact in a classroom activity, and they are not able to do that, that's going to impact their education because they're not going to be successful in getting their work done. Additionally, once we find that they do have an educational impact, then we have to determine what is going to be their specially designed instruction. And that means that we're going to have to adapt as appropriate to the needs of the student in the content, methodology, and the delivery of the instruction. A student could have could be found yes in all of the areas that we've previously talked about for autism disability, but they might have difficulty accessing their education, and so then we're going to have to do the specially designed instruction, and that has to be tailor-made for each student. We have to look at it in terms of how are they going to access general curriculum, not just meet the state standards, but also how are they going to be able to interact with all the other kids. The ASD report that comes out of our ESD is going to help paint the picture of what that student needs, looking at their strengths and their weaknesses, and it's going to help determine what the needs of the students are in order for them to be successful in that school setting. And that includes all environments of their school setting, from recess to lunch to academics, and it has to be able to meet each child's need individually, and that is what makes it different from the medical model.
Hi, this is Jen again, and I'm talking about 3-year evaluations. So, when a team is looking at a reevaluation timeline for a student with ASD, you want to go ahead and review the existing information in order to determine whether any additional information is needed and what specific evaluations will be conducted. So in the TAP, they actually use this terminology. There is an array of pathways to reestablish an eligibility. So you're going to want to look and see if there's any significant changes to the student's level of functioning or autism characteristics that they have displayed. So is there something new that they're doing? Is there something they used to do that you're not seeing as much? That is something that you really want to reflect on and evaluate to see if it's significant. The team is questioning the continued need for the ASD eligibility. So is there a reason to be serving the student with specially designed instruction? Do they need the supports that you're giving them? So that's an area where you really need to reflect on that, and you may need to do additional testing to have the student either continue with services for their ASD eligibility, or you'll discontinue it. The team determines there have not been significant changes that require a deeper look at the child's development, display characteristics, or academic performance, and may choose to pull forward more or all previously completed evaluation components. Reevaluations occurring after January 1st, 2019 must adhere to the updated ASD criteria. So if you're going to go ahead and pull that information forward, you're going to need to make sure there's been a hearing screening, a vision screening. The developmental history has been looked at and assessed or collected at this time, and social communication assessments have been done. Previously completed components may be usable if they align with the updated eligibility definitions, components, and criteria. Okay, here's your best practices for using previous assessments to reestablish eligibility. Consider the age of the child. If you're looking at the child possibly going on to a middle school situation or on to high school, you might want to gather more information to give them the supports they're going to need in those new environments. If ASD continues to be the best eligibility to describe the student's learning style, then you're okay to move forward with your past eligibility, or you may need to gather some more information so that you can work as a team to support the student. If the team has sufficient information to effectively continue to serve the student and develop appropriate educational programming, you can go ahead and reestablish eligibility. Yet again, remember what the new ASD eligibility form is asking you to collect, and make sure you have those 4 things that you previously weren't required to have. Significant transitions coming up for the child that may require the team to examine potential needs based on increased rigor or new expectations or requirements that may occur in the student's educational career or lifespan. So again, elementary to middle, aging out of service, maybe you're looking at a transition program. So maybe there's been some medical issues. That's on the next slide. Just a moment. There we go. So 3 additional things that a team should look at would be considering if there's been significant medical or medication changes since the last eligibility determination. So you want to see if check with the family, see if there's been a change in medication, if there's been some trauma or anything that's happened in their family that could impact the eligibility for the student. When the team determined to carry forward some or all of the required components for the previous evaluation eligibility discussion between the team members, it's really important to include that parent or caregiver, and they need to be in agreement so that they understand that you are not collecting new additional evaluation or testing. They need to be aware of that, and that would be done at the evaluation planning meeting. When the team determines all previous evaluation components can be used to reestablish eligibility, it's best practice to draft an informal summary. We have discussed that a little bit, and what they are saying in the TAP is that when the team determines all previous evaluation components can be used to reestablish eligibility, it's best practice to draft an informal summary. So if you want to go ahead and do that, they're saying that's a really good idea. It's really important to make note of that on your evaluation planning meeting notes, maybe in your written notes, and also document that on your prior written notice. Typically, when you're going forward with a 3-year evaluation, you also should include observations and a functional communication. That would be best practice too.
Hello, it's Alan again, and I'm here to talk about the new eligibility form for autism spectrum disorder. Now, there are 3 versions of this form. There's the one for early intervention, and then there's also the one for early childhood special education, and then we have the school age eligibility form for autism spectrum disorder. So in looking at this new eligibility statement, one of the things that is different is that the OARs have now defined what's required as far as developmental history. So if you go to the OARs and look, there's a series of topics and questions that they want you to cover and ask, things like prenatal medication, drugs and alcohol, things like environmental factors. So if you're using a developmental history that's been gathered previously, or you plan to do one yourself, make sure that you hit all these points in the OARs so that you're legally compliant with meeting the criteria for developmental history. And then one of the other changes that we have noticed is for the 3 observations, they've actually specified what needs to happen for each observation. So for one of the observations, it's required that it's a direct interaction with the student. And this can be the ADOS-2, which is one of the instruments, or it could be an academic assessment, it could be a student interview, and so one of the observations has to be a direct interaction. The other observation needs to be an observation of a student interacting with either peers or a familiar adult in an unstructured environment. So a lot of times what our evaluators do is we go to things like recess or PE or lunch to observe a student interacting with peers. One of the other changes for the eligibility statement is for the school age eligibility is that a medical statement is not required to do for an evaluation for autism spectrum disorder. That's for students who are of school age, so 5 to 21. However, it's at the discretion of your school team. So if the school team feels that they need to gather more information from a medical professional, they can require that to be part of the evaluation. A vision and hearing screening also is a new component. So if a existing vision or hearing screening has not been conducted, then a school team must obtain a new vision and new hearing screening for their student. And this is important because for a lot of our assessments for autism, we're looking at social responses and communication. So if a student is unable to see or hear, that could confound the results of an evaluation. And then the biggest change for the eligibility statement comes at number 11, in which the characteristics of autism spectrum disorder have now been divided up. So previously, under the old eligibility, communication and social interaction were 2 different categories, and now they've been combined into one. And so for this first section, under social communication and social interaction, the student must have deficits in all 3 of the boxes. So deficits in social emotional reciprocity, deficits in nonverbal communicative behaviors used for social interaction, and deficits in developing, maintaining, and understanding relationships. And they must be persistent deficits that are across multiple contexts. For the next section, for the old eligibility, the patterns of behavior that are restricted or repetitive in nature and the unusual responses to sensory experiences have now been combined into what's called the restricted repetitive patterns of behavior, interest, or activities. And so for this, a student can have at a minimum 2 of the 4 characteristics. And so they don't have to meet all 4 of these following areas, but they have to meet 2 of the 4 at least across multiple contexts. So the 4 areas are stereotyped or repetitive motor movements, use of objects or speech, insistence on sameness, inflexible adherence to routines or ritualized patterns of verbal or nonverbal behavior, highly restricted fixated interests that are abnormal in intensity or focus, hyper or hypo reactivity to sensory input or unusual interest in sensory aspects of the environment. Again, they only need to meet 2 of these 4 criteria, and it has to be across multiple contexts. And then, like we've talked about in this presentation, the following questions are what's different from the previous eligibility. So addressing the fact that the characteristics of autism are generally evident before age 3, but may not have become fully evident, so the team has to determine that that is the case. The characteristics of autism spectrum disorder are not better described by another established or suspected eligibility for special education services. So again, we have to make sure that when we're looking at eligibility and we're looking at those characteristics, that the characteristics that are found are not better described by another suspected or established eligibility. One example could be looking at the boxes and saying, oh, the student has an insistence on sameness and flexible adherence to routines or ritualized patterns of verbal behavior or nonverbal behavior. That's also a characteristic of a student with obsessive compulsive disorder. So what the team would need to do in that case is determine that the characteristics seen are not better described by another eligibility or suspected or established eligibility. But it is true that students can have multiple eligibilities. And then again, the question about emotional disturbance. If a student is eligible under autism spectrum disorder, that has to be their primary eligibility, not emotional disturbance. So if a student has both of those eligibilities, autism must be established as the primary. And then, of course, we have to answer the questions if the student's disability is having an adverse impact on the student's educational performance. And of course, the student needs special education services as a result of the disability. And then the next questions are the same as the previous eligibility. We have to rule out that the eligibility is or is not due to lack of appropriate instruction in reading or math, and it's not due to a limited English proficiency. And then we answer the question if the student does or does not qualify under special education with the eligibility of autism spectrum disorder. And then what we have done is we've revised our LBL ESD macro report, in which we report out our results for our evaluations. The couple of things that you would notice in our reports is the following: that when we look at our evaluation report, we've created a box in the front page that lists all of the assessments that were done, the date it was done, and who the evaluator was. This is in an effort to help our case managers who are filling out the eligibility form, that they could look at this table and then fill out who the assessors were, when the date was conducted, and what the assessment was for ease of paperwork. And then what you'll notice is that all of our observations are at the front of our report. And so with the assessment summary, we've decided to list all of our observations together. And so this could be done by a speech language pathologist, an autism consultant, or a school psychologist. And then you'll see that the autism evaluation comes first. So whether it was a school psychologist or an autism evaluator, what you'll see is those instruments there. So maybe an ADOS or an ASRS or an SRS. And then the rest of that report looks pretty similar. We have results from the speech language pathologist, if there was a learning consultant doing academic achievement assessment, or if there's a school psychologist doing cognitive assessment or emotional disturbance assessment, those results then follow. And what one of the biggest changes is at the end of our reports, we summarize all the characteristics of autism spectrum disorder, and we've made it to look similar to our eligibility statement. So what you'll see is under each category, so for instance, you take deficits in social emotional reciprocity, what we have is we have information provided by one evaluator, so say it's our speech language pathologist, and then she might provide results from a file review, what the parent says, what a previous evaluation says, and then what their current evaluation says. And then we've added a piece called educational impact. So how could this then impact a student in school, or how do we see this characteristic impacting a student's access to the general education curriculum? And then what we've done is we've also let multiple evaluators put in information under the same category. So then as a school psychologist, what we might see is some difficulty with the social emotional reciprocity in one of our observations. So then what we could do is put our information under there as well, so that will help the team confirm that the deficits are existing across multiple contexts. And then, of course, we also have all the tables which describe our assessment tools, as well as our recommendations for things that can assist the team as well. And so those are some of the major changes in the new LBL autism report that will be rolled out in January.
Talk now about the new LBL report. We will get a picture up here for you, but the big thing that I want to tell you is that it's going to look a little bit different, especially at the beginning. When we're looking at that report, we're going to be looking, when you open it up, you're going to first see that there are going to be the areas for the observation, and it's going to help you to be able to complete your eligibility requirements easier. So when you open up the report, it will have the observations, and there will be observations probably from the SLP, maybe from the school psychologist and the autism specialist. It could even be the learning specialist who is who saw parts and pieces of the student in different environments. So we're going to be able to write that up, and you're going to be able to take that information and put it onto your eligibility form. The rest of the form looks a lot pretty typical of what it did before until you get towards the end. After all of the testing part is talked about from each of the different disciplines, you're going to see some tables, and those tables are going to talk about the deficit areas that include social communication and social interactions, as well as restricted, repetitive patterns of behaviors, interests, and activities. And there's going to be bulleted items of each of the evaluators and what they saw in each of those areas. So again, you're going to be able to put directly onto the ASD eligibility form that there was observation done, that there's educational impact, and these are the things that show what the reports say. And then from there, we're going to go straight to signatures, and then we'll have a discussion about what all of the tests mean. So that part isn't any different. And then Alan is going to talk to you a little bit more about what the different areas look